I don't know if you've been paying attention to a lot of the things going on with nursing. It's basically like people are fed up. Every time I go online and I do even a simple search, you see nurses have started to take advantage of YouTube and air out their frustrations with the profession. And I, for one, have been, as you know, I've been a nurse for 12 years now, going on 13 years. And it always seems like a lot of the things that I was complaining about from the beginning of my career, I'm still seeing those things today, and most of it hasn't changed. You have strikes on strikes upon strikes, and it seems like we're not getting anywhere. And I keep wondering, what's the difference? Why will this strategy, I mean, insanity is doing the same thing over and over and expecting a different result. Why would it change this time around? So I'm wondering, in your experience, because you've been a nurse now in Canada, what's been your experience working as a nurse, clinical bedside, and what's been your experience in the profession?
Thank you for inviting me on your channel. This will be my first time doing this, but I'm excited. I've been working as a nurse in Canada for about 2 years now, and it's been challenging. It's been rewarding, and it's been challenging as well. Rewarded in the sense that since I started picking up travel contracts, I've been able to have a good flexibility with my time. I've been able to make more money as well, but obviously the downside of that you travel all over, you miss a lot of birthdays, you miss a lot of good time with your family and friends. The challenging part is exactly what you talked about. Some of the things that you see when you start the profession, and then you're hoping that hopefully down the line, either the government or the management works on those situations. But it's only getting worse. You come into the hospital, you come into work, and you have a lot of shortages of nurses. You have yourself taking care of 5-6 patients on a day shift. Sometimes during a night shift, you're taking care of 11 patients, and that's a very unsafe environment, not just for yourself, but for the patients you're taking care of. And this situation has been going on for a very long time, and you find out that management doesn't seem to care about it. The government doesn't seem to want to do anything about it, because I remember when I started hearing about travel, so I started wondering who is paying us. I started wondering, where's the money coming from? Why do nurses have to travel, leave their place of comfort and travel so far to make a lot of money? Why can't this money be given to, why can't we have a solution whereby the money is given to nurses wherever they are, and kind of like an increase in salary, like better incentives to make those nurses stay and work. So it's a situation that calls for nurses to look inward. So this is a time where nurses have to really take care of themselves, since we've come to a point whereby we understand that it's not gonna get better, and we are suffering. There's a lot of nurses that are suffering because of this. Like, there's a lot of nurses that are having broken backs, broken ankles. They are doing hip replacements. We are starting to see younger nurses in their 20s, in their 30s, having workplace injuries just because they are working short, and because they are in an unsafe environment. So, like I said, it calls for nurses to look inwards. We need to start taking care of ourselves. We need to start looking for options out there to make money, and there are a lot of options out.
So you talk about looking inward. I know recently I made a video about nurses, especially staff nurses, being underpaid, and the only way for you to make any meaningful income is if you choose to travel. Now, obviously, as a traveler, you face a whole different set of challenges there, because it's kind of designed for the single person without a lot of responsibility. Maybe doesn't have a partner or doesn't have children. It's harder to travel with children. So that lifestyle is meant for a certain demographic. So now just like the question you raised is valid. Why is it that they're willing to pay crisis travel, but the ones who are loyal, who have been at the hospital for a long time, they don't get paid? And when I made the video, someone made a comment, said, you think, because the title of the video was why I quit my $300,000 a year travel. And a lot that video was basically channeling my frustrations, the fact that for me to make any meaningful income, I have to be a traveler. But the person made a comment and completely ignored all the points that I made and said, you're getting paid $300,000 a year and you're complaining. So it seems like people focus so much more on the money and don't care about everything else. What's your thoughts on that?
Yeah. Well, you don't want to listen to people who just want to make a hot comment, like just a one-liner, without diving into details of the topic in question. Because to be a travel nurse, it's a lot of sacrifice. It's a lot of sacrifice for the individual.
Talk more about those sacrifices, because you just recently did a travel.
If you're single, it's not so much. If you have a partner, if you have kids, it's a lot, because some of the first of all, if you're a travel nurse, you're being taken away from, you're being thrown to another city. It could be a village, it could be a remote area. So you're taken away from your friends, you're taken away from your family, and you're thrown into a remote area. Usually some of these facilities are already in crisis. They already run down. So you're coming into a place where you're expected to start working with maybe 2 shifts or just just one shift orientation. You're expected to just start working immediately. You're also expected to obviously they are bringing you in because they are already short. So you're expected to work short, and you're expected to just do the job with little orientation. That's one of the challenges. Also, you find out that some of the staff in those facilities can be very mean, because they already know that you are earning the big bucks, but they forget the challenges that they forget the sacrifice that you made coming there. But all they are thinking, you're already here, you're making the big bucks. So once you come in, they are giving you the worst assignments possible. They're giving you the worst patients possible. So those are some of the challenges I faced. And it can be daunting. I don't even want to talk about the challenges that you face as a male nurse,
No, let's go there.
No, you know what? That's another topic altogether. That's topic for another day. So the challenges that you face as a male nurse, the challenges that you face as a nurse who is an African American, that's a challenge there. Or a Black nurse, that's a challenge right there. So those are things to consider.
Okay, so we've highlighted, and you're right. If we were to start going into detail, it's just this slippery slope of, we could stay here all day counting on all the issues. And yes, we're going to talk more. We're going to make a video about what it's like to be a male nurse or even a Black male nurse out there. You're absolutely right. Throughout my entire career, I faced all kinds of challenges that if you don't walk in my shoes, you wouldn't understand it. And I think you're going through those things, so you have a really good understanding of it. But since we've highlighted the problem, what would you say is like 1 or 2 solutions that you see might be, one from the perspective of the governing bodies for nursing, maybe American Nurses Association or the boards of certification or the government even, and then what's a solution from the perspective of the individual, and how do we alleviate these problems that they just highlighted?
Well, first of all, I'll look at. I'll talk about the solutions that the government can put out to help the situation. The government, the organizations, the nursing organizations can come together and first of all, the government has to consider nursing as an occupation that they can't do without. We have the largest number of staff in a hospital. We have the largest number of staff in a retirement home. So it's not you can't do without nurses. So they have to recognize that we are very important, and we are important as doctors. We are as important as doctors, right? So having said that, they have to look at our incentives. They have to pay us the money that we deserve. So if it is possible, they should bring these organizations together, people that can actually speak the nurses' mind and tell them this is what we deserve. This is what we deserve to be paid. And honestly, I don't think anybody wants to travel so far to work. People want to spend time with their families. People want to spend time with their loved ones. If they pay us right, we would stay. People would stay. People won't leave nursing. There's a lot of nurses that have left. In fact, I'm telling you that I've seen nurses who have left nursing and joined firefighting. Yeah, I have seen nurses who have left nursing, joined firefighting, and I've seen nurses that have left nursing and joined, certain occupations that you wouldn't have thought that they would have joined, just to have that time with their family. So it's the most important thing is the incentives, the pay. The pay has to go. The pay has to match the amount of time and the amount of energy that we put in. The pay has to match our skill level. Right now, nurses are not happy. What they are paying nurses doesn't cut it. It doesn't cut it. So that's go ahead.
Yeah, you do point out something specifically on the fact that the pay doesn't match the effort. I compare it to software developers. Software developers are very pivotal to the tech industry, and they're compensated very well. They're even treated. You can see some of these companies or startups, they court their software developers like an NFL draft, and they give them equity compensation, they give them all the perks, and they go to work and it feels like they're they're treated very well. Okay. Yeah. But then you come to the healthcare space, the nurses are treated like they're disposable. You don't have any and you don't even have any leverage in negotiating your rate. Yeah. Only one party dictates all the terms. So there's definitely something missing there. Is it because it's a women dominated space, or what do you think is causing
that? That could be a very good point, because and that's the reason why I'm all for equality of pay. Until you're on the other side, that's when you understand why women are clamoring for equality of pay, because that pay gap is there. And it's so, I think nursing kind of like highlights, that even though it's not really obvious, but it kind of highlights, gender, the pay disparity with different genders. So obviously, I would think that could be part of the reason why pay hasn't really gone up, or there's a cap on nurses' pay, because we look at doctors. Doctors were getting a lot of incentives during the pandemic, but yet we are being called we are being called for the
frontline workers, heroes, work care, all that.
We are being called the frontline workers, but then are you actually compensating us for the work that we are doing? That's the question. It's not all about those name calling, trying to butter us. That's not what we really want. We want to be equal. We want to be duly compensated. So that could be one of the reasons why it's been a real challenge to get our pay right, because it's a career dominated by women.
Okay, but we have American Nurses Association. We have governing bodies or representatives, including unions, that are supposed to get together with administration and get together with policymakers to make our working environment, our working conditions better. Why do you think that they fail?
Honestly, I think politicians are the same everywhere and at all levels. The people in the union are like politicians. It's a situation whereby they go in and they promise they tell you that, okay, when they go in, this is what will happen. You're gonna get these incentives. But by the time they go in, it seems like when they go and try to have these negotiations with people in the government, legislators, members of parliament, it just seems like in that meeting, there's some corruption going And then they come back and they tell you, oh, there's nothing that can be done. Like there's no money. All of a sudden you see all these, roadblocks that appear. They'll tell you, oh, there's just this can be done. No, it's gonna take like 5-6 years, for them to make it happen. So it's just, I think it's a thing of willingness. Are these politicians willing to make this happen for nurses? And I don't think they are. And I really don't think that these unions are doing enough. But I would say it's not the responsibility of the unions. I think it's the responsibility of the government to make it happen. Because at the end of the day, the kind of service that we provide, it's a core service. It's a very important service. It's not like we are not like the tech guys. This is an important service that is needed 24 hours a day. Hospitals don't close. Retirement homes don't close. Right. This is a service that is needed every day, every hour, every second. So once they realize that and come to terms with it, so that they would make it happen.
I like to believe that, but I know that it's not going to happen. This conversation has been going on for a long time with previous generations, now in our generation, and I see it not happening. And it's just a symptom of a larger issue, like you pointed out. And the solution, in my opinion, is for nurses, because we're the product, we're the people who are needed. The individual nurse has to now realize that you need to take your own fate into your own, and whether it's seeking the right opportunity for yourself, venturing out into other things, but waiting on the government, I just don't see it happen.
Sorry to cut you short. And we are. There's a lot of nurses that are venturing out, and one of the things they are doing is nurse entrepreneurship. So they are going into they are leveraging on the skills and the knowledge that they've gained throughout their career, and they're going into these other things that would help make them money, help make them money, and just give them that flexibility of time, and I think they're happy for it. And we can dive right into those different ways nurses make money through nurse entrepreneur.
It's really unfortunate now that I'm on this side, after having all these time in the profession, I see the disparities in how how physicians are trained versus how nurses are. You can go through all the nursing education you want, but it never teaches you to be an independent practitioner. Never teaches you that you can actually practice independently. You can grow your brand. But doctors, right from the bat, they have their name on the building. So they're already building a brand from day one. They're running they're doing marketing, they're negotiating contracts. So it's now time, especially now that we have the information, whether it's on YouTube or on social media as a whole, is now time for nurses to take your profession into your hands. Learn marketing, learn how to build a brand, learn how to use the skills that you have, which are actually transferable, whether it's critical thinking or customer service or even tech. Those skills are actually marketable, and you can build a brand on.
Yeah, absolutely. And nurses, the funny thing is the student nurses know. They know. Believe me, they know, because I was on the floor one of the days I was working, and I was talking to one of the nurse preceptors, and I was just engaging her in a conversation about what the students are like right now. And you know what, she tells me that she has 10 students and only one wants to work in a hospital. That the rest are talking about these other things that we are mentioning, nurse entrepreneurship. They're talking about going into nurse aesthetics. Some are talking about, working in a private clinic. No one wants to work in a hospital. So time will come, and that time is already here. That time is already here where you go into hospitals and you wouldn't have nurses that would attend to you, and this would affect everything. Maybe that's what the government is waiting for. Maybe at that time, that's when they're going to step up and do something about and give a permanence to the the nurses' wage and salary.
All right. Well, I wanted to cut it short. We're 35 minutes. I think that we can cut it short here, unless you want to keep going.
Wow, it's an exciting conversation. Maybe the next episode we can talk about different ways nurses money,
Yes.
without having to work in a hospital or work in.
Yes, absolutely. Again, thanks for sharing. You actually did really good. This is this is very informative, and I think that it's time for us to, as nurses, as part of the profession, we have a responsibility to help the future nurse or the student nurse and give them the information that they need to succeed, whether as an individual or even just improving the profession as a whole. And I'm glad that you were able to join me to do that.
All right. Thank you. Thank you for having me.